Hello students. In this video, I am going to tell you how to tackle some lengthy and case-based, image-based questions in your NEET MDS or INI-CET exam. Now consider an example of this case-based question given over here. Now you see that there is a long description of the question followed by an image, and then you have 4 options. Now technically you only have 30 to 45 seconds per question in the exam to tackle any question. If you have a very lengthy question, you are going to end up using a lot of time just reading the question. And in case if you have to repeat reading the question, just imagine how difficult it can get. So one very important trick that I would like to tell you is read the last line of the question first. In this scenario, it would be which of the following statement is most accurate regarding the etiology of the associated lesion. So now you know that you have to look for factors that will be associated with the etiology. Now look at the image. So you see an edentulous ridge and you see that there is a flabby tissue associated with the ridge. Now this is very clear that it is epulis fissuratum, which is associated with chronic irritation from a denture. And without even reading the whole story, you can kind of predict the possible answer. Now to be safe, it is always necessary that you read the whole case because you might miss out on some information and you do not want to take a chance. So you can quickly brush through the case, or you can first take a look at the options and then go to the case, whichever works for you. In this case, because I already have an idea of what the options could be, I'm going to read the case first. So this is a 68-year-old male, old patient with complaint of soft tissue growth in the lower denture, and there is elongation fibrous tissue along the denture flange. So we know that this is related to denture stomatitis or chronic denture irritation. Now look at the options. It is primarily caused by a fungal infection, which is true because candida can predispose to denture stomatitis and an epulis fissuratum. Related to chronic irritation, has high prevalence of gram-negative anaerobic bacteria, and it is majorly due to viral infections like HPV. Now the last 2 options are definitely incorrect because it is not associated with bacterial and viral infections, but it could be associated with candida and chronic denture irritation. But here the main lesion is the flabby tissue. It is not denture stomatitis. So the correct answer would be option 2. So with this approach, you can basically kind of tackle very lengthy and image-based questions very easily, and you can predict the answer depending on what the last line of the question is stating. So I hope you found this tip very useful. Try to apply this in your mock exam so that you are thorough with this tactic when you have to apply it in your final exam. Thank you so much for watching this video and good luck.